For my next chapter, I decided to do chapter 22, Infectious Diseases Manifesting in the Respiratory System. So we'll kind of go over some features of the respiratory system, some microbiota, and illnesses and diseases of this system. So first, we're going to kind of talk about those anatomical features of the respiratory tract. And in our upper tract, that contains our nose, pharynx, and larynx. And then our lower tract contains our alveoli and those alveolar ducts, bronchi, our bronchioles, and our trachea. So we'll kind of go in a little detail about these. First up, we're going to talk about our nose. So this is actually where normal breathing occurs. Um, our nose is kind of an air conditioner for our airways. Natural mucosa in the nose is actually the first line of defense against air particles. And cilia and mucus filters out those large particles. So our nose kind of helps filter out dust or any debris that will kind of try to go in our nose, and that protects it from going into our airway and affecting our breathing and stuff. So next we'll talk about our pharynx and our larynx. So these actually condition our inspired air, um, and it also will humidify and warm the air. It contrives to separate ingested material from inhaled gas. So it allows oxygen to pass through to our lungs, but it kind of tries to separate our food and things we drink from going into our lungs. Um, and it also keeps particles from going into our lungs. So, pretty big deal. Next, we have our trachea, and this kind of continues that filtration. Air passes over the cilia and the sticky layers of the mucus in the trachea. It also transports cells of the immune system, and this is where lymphocytes and macrophages trap and destroy foreign particles. Here we have our bronchi and bronchioles. These actually moisturize the air you breathe, and these are lined with cells that create mucus. Mucus actually traps bacteria, viruses, and fungi to prevent infection. And last, we're going to talk about our alveoli and alveolar ducts. These are actually the first line of defense to the lower pathways. These will send out macrophages to ingest and destroy bacteria and viruses. Um, the pulmonary phagocytic system actually immobilizes, kills, and walls off those invading bacteria cells. Next, we're going to talk about the normal microbiota that we have in our respiratory system. Some people may have these and never be affected by them, and some people may. So we have the Haemophilus influenza, the Staphylococcus aureus, the Neisseria meningitis, and our diphtheroids. We'll go a little more in detail on the next slides about these. First, we'll talk about the Haemophilus influenza. So this is commonly found in your nasopharynx. It is actually transmitted by close contact with an infected individual. Droplets in the air from a sneeze or a cough can be inhaled, and that's what causes the infection. And this can cause pneumonia. Next, we have Staphylococcus aureus. This is commonly found in your respiratory tract. It actually reaches your lower tract by air uptake during breathing by you, the host. It is associated with a wide range of infections that actually includes pneumonia. Neisseria meningitidis. So this is commonly found in your nasopharynx. 1 in 10 people actually carry this bacteria without becoming ill. Like I said before, you may carry these your whole life and not be affected by them, but some people are. This will actually cause meningococcal disease and meningococcal pneumonia. Next, we have our diphtheroids, which are also called diphtheria. These are commonly found in your mucous membranes, and they're actually characterized by local inflammation in that upper respiratory tract. This can actually cause nosocomial pneumonia and bronchitis. So here we're going to get into the diseases of the respiratory system. These include, but not limited to, the common cold, sinusitis, pharyngitis, sorry, and otitis media. Some of these you've had, I'm sure. Everybody has had the common cold. Um, some of these maybe not. So our common cold. This is that common viral infection of our noses and throats. And we know that symptoms include a runny nose, sneezing, and congestion. And you're usually pretty miserable. I can't wait to get it over with. It's usually harmless and it's gone within about 2 weeks. But if you end up having a high fever and severe symptoms, you should probably be seen by a doctor because you probably have more going on than just the common cold. Next, we're going to talk about pharyngitis. So, this is that pain in the throat that can come when you swallow, and it often accompanies a cold or a flu. So, you have that sore throat that kind of hurts when you're swallowing food or trying to drink and swallowing. Um, Symptoms include sneezing, a runny nose, headache, cough, fatigue, and body chills. The most common cause of this is a virus, and the treatment just includes relief of your symptoms. So, typically, relieves on its own. Next, we have sinusitis. So, this is when the cavities around your nasal passage become inflamed. This can also be triggered by a cold, but it is sometimes triggered by allergies, and it usually resolves on its own. Symptoms include a headache, facial pain, runny nose, and nasal congestion. And that's typically because everything up in here is so congested and your sinuses are so congested that it just causes all this up here to hurt. Chronic sinusitis may actually require antibiotics, and it's caused by infection or growth. So if it typically doesn't resolve on its own, you may have the chronic version and may need to see a doctor. Otitis media. So this is actually an infection of the air-filled space behind your eardrum, which is considered your middle ear. It's usually caused by a bacteria or a virus. Symptoms will include ear pain and fever. Sometimes your ear may drain a little bit. Um, Most cases of this usually go away on their own, but you may need to see your doctor for antibiotic treatment, and they may prescribe an oral antibiotic, but they'll probably also prescribe a antibiotic ear drop. Last, we're going to go over some infections that can occur in your respiratory system. These are pretty common things that you hear of all the time, especially if you have kids. We have the whooping cough, RSV, and influenza. So none of these are fun, um, especially the whooping cough and RSV in children. That's a big deal. So first we're going to talk about that whooping cough. It's actually highly contagious, um, and it is a respiratory tract infection. It's very dangerous for infants. Some of the symptoms of this include a cough that sounds like a whoop. It's real barky cough. It's different than a normal cough. A runny nose, nasal congestion, and sneezing. So the whooping cough actually goes through 3 stages: a catarrhal phase, paroxysmal phase, and a convalescent phase. Vaccination is actually the main prevention of whooping cough. Like I said, very, very scary in infants and young children. It's not something you want to experience. Next, we have RSV. This is actually spread from person to person from someone who is infected via droplets or direct contact. So an infected person may sneeze and cough, um, and that's how people get infected. You you hear of a lot of kids having RSV. You don't really hear of a lot of adults, but adults actually do get RSV. It just kind of acts like a common cold does. Um, but in children, it's very bad. Um, in children younger than 3, it may actually move into their lungs and cause wheezing. In some children, the infection can actually turn into a severe respiratory disease. Sometimes young children can pass away from this. It's just really not something to play about. Treatment is to relieve symptoms. So something to watch for. Very scary, something you don't want to see in your children. And last, we're going to talk about influenza. So it's a common viral infection, and we know this as the flu. Um, Symptoms include a fever, chills, muscle aches, cough, congestion, runny nose, headache, and fatigue. You will fever for days, and your body will hurt, and you will not want to do anything with the flu. This actually attacks the nose, throat, and lungs. Young children, older adults, and pregnant women are at high risk. The flu kind of attacks them a little different than it does in healthy younger adults. Young children, their immune system just isn't fully developed. An annual vaccine can prevent the flu. The treatment for the flu is actually to alleviate symptoms, and Tamiflu can be prescribed by your doctor.